We're recording? Okay, we're good. All right. Hello, everybody. Good afternoon. Everybody braved the cold weather to get out here today. Is it beautiful now? It was freezing when I left this morning. It's awful. I'm like, do I live in Florida? I'm Catherine McDermott. I think many of you know me, but if those of you who don't, I am a psychiatric mental health nurse practitioner who spent the last 25 years or so taking care of patients with cognitive impairment and dementia. I'm also a co-owner here at Town Square. My husband and I own this Town Square. It is a franchise, but this is our model here. And we have deviated a little bit from the franchise in that we have created more of a medical model in terms of really embracing the disease dementia and really trying to become a resource center for families that are dealing with folks and taking care of folks with dementia. So that's about me. So today, and I do this educational series once a month, and I try to vary it and really try to hit on important information that I can help you folks and try to figure out where we can be as supportive as we possibly can as you're, making your way through this journey. I will try to speak up as loudly as I can. If you can't hear me, let me know. But I try not to use a microphone. It's just hard for me to do that. So, all right. So today we're going to talk about communicating with people with dementia. And I really find that this is a very important topic because when you communicate with someone, it creates the whole tone of how life is going to go with this person. And we really need to be aware of the limitations that people have when they have dementia and the best way to communicate with them. And it's different than anything else we do. It's not the same. A lot of times people will be like, well, they're like a child. They're not like a child. And I'm going to debunk that several times as we talk about this. Nothing irritates me more than when patients with dementia are treated like they're a child. Because they're not. And they're not stupid, which is oftentimes what we hear from our members when they say, I'm not stupid, don't tell me what to do. Or families will tell me repeatedly that their loved one will say that to them. Well, then we're miscommunicating in some way. So we're going to talk about that today. All right. Some of it is going to seem like common sense, but I'm going to venture to say I'm going to add some spins on it that are going to make you go, hadn't really thought about it that way. Okay. All right. So first, when we are dealing with somebody who has dementia, we are dealing with somebody who has a brain disease. Their brain does not process information the same way an average person with normal cognition processes information. So the first thing we need to do is approach them differently. Okay? So we want to smile. We want to be very warm. We want to leave pauses in between our phrases. Okay? Very different when we approach somebody with the correct demeanor, the correct body language. The other thing that we absolutely have to do when we're dealing with somebody with cognitive impairment is we have to get their attention. Now, my husband and I have been married for 38 years. I made him go get his hearing tested a couple of weeks ago. Came back, he said, my hearing's perfectly fine. You don't have my attention before you talk. Now, he's cognitively intact, but if I don't get his attention, he misses that first part of what I'm saying, and then the context is completely lost. Take that few extra moments to really make eye contact and make sure you have their attention before you start speaking. If you start speaking before you've even done that, you're already behind the 8 ball, and then it just goes downhill from there. Okay. Reduce distractions. I cannot tell you how many times I go into a patient's room in an assisted living facility and Fox News is blaring at 60. And the first thing I say to them is, can we mute the television? If something else is going on, and your brain doesn't process information well, and you have multiple things going on, how well are you going to process what that person says to you? Okay. So like I said, a lot of it is common sense, but we have to think about it within the context. We have to be aware. And a lot of times that's what it typically is that we're not aware of how important these things are and how much they impact our loved one who has dementia. Allow extra time. We live in a two soundbite society, right? We expect everything like this. We want it fast. We speak quickly. We move quickly. I mean, all you have to do is try to drive in Florida, right, to realize how people are rushing, right? So the one thing that we need to do when we are with somebody with dementia is we really need to take that few extra seconds to allow them to process the information that we're going to give them. And so when we give that information, and we're going to talk about this a little bit more, so I'm not going to get too ahead of myself here, but I'm just going to talk about, we need to think about that timing, okay? We need to validate feelings rather than correcting facts. And this is, we talk about reorientation versus redirection a lot in memory care and in caring for people with. We have to pick our battles. We have to think about how important really is it that we reorient them in that moment. Is it really important that they think it's Wednesday and it's really Tuesday? Because none of us, how many of us, raise your hand, like to be corrected? I love it when my husband tells me I'm wrong, right? None of us. It all makes us feel badly because then we doubt our, and when you are cognitively impaired, you're already confused as it is. And now I just told you were wrong about what you think. It makes you anxious and then it makes you angry. Okay. How do we speak to people with dementia? We use short, simple sentences. Very often, as I'm staging people out in their dementia, I will ask family members, can your loved one carry out a multiple step command? We've had this conversation, right? I can give him the plates and ask him to put them on the table. I can't add the napkins and the forks and knives and ask him to do all three at the same time. He can do one task at a time and one simple task at a time. Come on in. And then one idea per sentence, right? We really need to be very careful about not putting too much information in that one sentence. We want to speak slowly and clearly, and we want to listen to the tone in our voice. We don't want to shout. Patients will say, she yells at me all the time. And the spouse will say, I don't yell at him. He doesn't listen. Right? Goes back to, did you get his attention? Did you speak slowly and clearly? Did you give him one thought at a time? Right? Perception is your reality, right? So if you're feeling like somebody's yelling at you, it simply can be the tone of their voice. And again, I say this every time I give a caregiver talk. You guys are doing an amazing job. And here I am standing up here telling you, here's all the other things you have to do on top of the amazing job you're already doing. The idea is that these things are going to make the amazing job that you're doing easier to do. So sometimes it feels like I'm asking you to do more. What I'm really asking you to do is shift how you're doing it. Because if the outcome is better for you, it will make your life easier. Okay. All right. People with dementia, typically, and you have to remember, we talk about this a lot, we talk about the staging of dementia. Most patients with dementia don't get diagnosed until they're in stage 4. Okay? That's when the symptoms of cognitive impairment start showing up. Okay? So by the time you're in stage 4 and going into early stage 5, you can't formulate and articulate a full sentence. Families tell me on a regular basis here at Town Square, well, I asked him what he did when he was at Town Square and he can't answer. No, he can't. He can tell you how he felt and he can answer a yes and no question. So we ask questions toward that end, right? We say, did you have a good day? It's a very simple answer. Did you have fun? Did you enjoy yourself? Again, we're asking them to validate the emotion that they were feeling, because that they can tell you about. But they can't say, we did watercolor, or we played, we played in the garden and planted plants. Like they can't articulate that information to you. And so asking them to do so, and I use this analogy a lot, is asking the paralyzed man to get up and walk across the room. How many of you would do that to a man sitting in a wheelchair? But every time we ask somebody with dementia to do more than their brain is able to do, that's exactly what we're doing. Okay, verbal cues. So we process information multiple different ways. We process it auditorily, so when we hear. We process it visually. We process it with a tactile sense, right? You place something in somebody's hand, you ask them to grasp it, they feel it, they can grasp it. So when we're dealing with someone with dementia, the more cues we can use, the easier it is for them to understand and process the information. So when I have a member of Town Square who's late stage 5, early stage 6, and I'm going to ask them to stand up, I go up to them, and use you, Pat. I get right down in front of them. I look them in the eye, and I go, Pat, we're going to stand up right now. And then I stand up, and I back away, and I wait 15 seconds. You know how long 15 seconds is? It's an eternity. Because as soon as I say something else again, they're still trying to process the first command I gave them. Now I've completely confused them. I'm getting frustrated because they're not doing what I told them to do. And it just goes downward from there. So, eye contact, warm, open presentation, getting them to get your attention, understand the command, and then give them time to process that. If after 15 seconds they didn't get it, repeat it or rephrase it. And this is where routine and similar words that we use all the time. Let's go to the bathroom. Let's use the restroom. Let's go to the potty. I don't care what you use. Use the same terminology. Do not change it. It has to be the same so that, because people with dementia cannot learn new information. Having said that, they can learn routine and rote. So repetition, what would make you and I crazy every day, right? Doing the same thing over and over again is what gives them that sense of control, is what makes them feel like they're in control of their environment, decreases their anxiety, okay? So use consistent words and say it differently, not louder. It's not that they can't hear you. If they can't hear you, it's because you didn't do what? Get their attention. You guys are good. You're listening. This is good. All right. And allow silence for processing. I remember when I went to school for psychiatry, and as I was doing my classes on therapy, one of the things they trained us in was therapeutic silence. And it was one of the hardest things I had to learn. You're sitting there with somebody who's struggling with some emotional issue. And as the therapist, you sit there and you don't say anything. You just sit there with therapeutic silence and allow that person to process their thoughts and then bring forth the emotion that they're feeling. And what we do with patients with dementia is very similar. We give them that safe space where they're not being bombarded with command after command after command, and we allow them that time to process the information. Now, yeah, if 15, 20 seconds goes by and absolutely nothing's happening, then you need to repeat, you need to rephrase, you have to redo the visual command that you've done so that they recognize what you want to do. Maintain comfortable eye contact. Now, we all know there's comfortable eye contact, and then there's like uncomfortable eye contact where somebody's like really like burrowing into your soul, right? Like that's not what we're talking about here. We're talking about making comfortable eye contact, smiling at the person so that they know that you're genuinely caring about how they feel. They're in a safe space and they can move forward with that. Face the person and keep a posture relaxed, right? So one of the things I talk about, I'm going to use you as my example here, Jen, is that we don't realize how intimidating we can be when we walk up to somebody and we stand over them like this. How's that feel?
Not good.
No, it's not. But how many times do we walk up to our loved one and go, come on, get up, we're going to go have lunch?
Okay.
Right? Yeah. We have to recognize our body language. We are in control of that environment, right? But we don't want the person with dementia to feel like we're controlling that environment. We want them to feel like they're the captain of their own domain and their environment. And so watching how our body language communicates that to them is very important. Okay, do not argue. How many of you argue with your loved one with dementia? Right, okay. Do not argue. There is absolutely no reason to argue. None. You're not going to win. You're going to be frustrated. They're going to get angry. It doesn't work. They don't have the cognitive ability to understand. They're never going to admit they're wrong. So it just creates a negative environment. And then the rest of the interaction feeds off of that. Sure. Which tone? The angry tone or the? Yes. Then their reaction is usually to react back angrily as well. Right. And because they're feeling defensive, right? They're going to defend themselves. You just told them they were wrong. They absolutely believe, and a lot of times this is where the delusions and the paranoia come in, right? Because the delusion comes in because they can't make sense of what's going on. I put my wallet right here, and now it's not here. Somebody came in and stole my wallet. Now, we all know nobody came in and stole their wallet. Like, it just didn't happen. And we want to tell them that. But telling them that is asking the paralyzed man to get up and walk across the room. So we're asking their brain to process information that they can't. So what do we do when they say somebody stole their wallet? We validate the emotion. Wow, that must be really correct. That's correct. Right, but I'm teaching you, and you're teachable, I can tell. You're going to say, that must be really upsetting, right? If your wallet got stolen, you'd be upset. I'm sure that we can get to the bottom of this. You're reassuring them. You're not telling them that they're wrong. They say, well, we need to call the sheriff. Well, that's a really good idea. But let's see if we can find your wallet first before we get the authorities involved. I'm not telling you that you're crazy. We're not calling the sheriff. I'm validating for you that that's how upset you are, that you think somebody stole your wallet. And so I'm going to be your person. I'm the person who's going to help you with what your concern is. Does that make sense? Okay. Like I said, common sense. Validate feelings. Redirect to a pleasant activity. Redirection can work fabulously, or sometimes it doesn't work at all. And I admit that to people all the time. I say to people, look, I'm going to give you these tools, and you're going to home and you're going to try them, and they don't work, and you're going to be like, this didn't work. Sometimes it will, sometimes it won't, and sometimes you have to change how you approach it. But once you get really good at redirection, it will be a lifesaver for you. And the way to redirect people is you want to redirect somebody to something that they enjoy doing. Nobody wants to be redirected and say, well, we're not going to look for your wallet right now, but we're going to go take a shower, because they don't want to take a shower either. So that's not a good idea. I'm going to help you find your wallet, but you know what? I'm dying for some ice cream. Oh, so am I. Let's go get some ice cream and we'll sit down. And now we sit down and we start having some ice cream, and I start talking to you about our granddaughter and how amazing she was and how we had a great visit together. And hopefully, because they have such poor short-term memory, they're going to forget what we were talking about. And it's not going to be as much of an emotionally charged conversation when we try to go look for the wallet later on. So redirection has to be something that they like to do. Now, you all know your person. You know what your person's love is, what they like to do, what's their kind of go-to. And this is where we also begin to realize that, well, they're diabetic or their sugar's not that great, but it's okay if they have ice cream now. Like, we're going to let our guard down a little bit. We're going to do the things that maybe we didn't always do before, because now we're dealing with a person with a broken brain who has a terminal neurologic illness, and quality of life is more important than quantity at this point. I'm going to say that again. We are dealing with somebody with a terminal neurologic illness. This is going to take them faster than normal aging. Dementia is not normal aging. And so we're so indoctrinated into prevention, cure, exercise, diet, take your medicine. Then we get to this point and we recognize that our loved one has a terminal illness and we want them to be happy for however much time they have left. We begin to change our mantra and how much ice cream we can actually have. Does that make sense? If I can teach people anything, to me, that is the most important message I can help people shift their thought process on. Okay? We want to keep our loved ones around as long as possible. I understand that. But we want to keep them around as long as possible while they're still happy and not miserable. Providing reassurance you're safe is so important. These are people who are anxious all day long because they don't understand what's going on. They don't understand what's happening. They can't process information. They can't, they struggle with just simple tasks. Think about how anxiety producing that is. They are, and many of them will come right out and say it to me. I'm scared. That's what I feel. I'm scared. So if you are that reassuring body for them, right? If you're that person who makes them understand that you're looking out for them, you're not going to yell at them because they lost their wallet. You're not going to tell them that absolutely nobody came in this house and stole your wallet. You're going to be that person who reassures them, who validates that emotion, and comes up with a solution for how you're going to help them. They feel cared for, they feel loved, they feel comfortable. They're not going to argue with you most of the time. Like I'm saying, not 100% it's going to work, but it's going to work a lot. Okay. So they do get agitated with you, or they start getting aggressive with you. They're going to come at you. They're going to push you. They're going to stay calm. Back away. Give them some space. Something has triggered them. Try to figure out what the trigger was, right? What was the trigger that made this person who normally is pretty mild mannered or easygoing now all of a sudden get to the point that they're agitated and aggressive with me? There has to be a trigger. And typically, people get like this when they're scared, when they're afraid for their own well-being. So oftentimes making sure their safety needs are met and that we're aware of what those are will oftentimes bring down that agitation and aggression. Offer simple choices, right? We're going to go sit down and have something to eat. You look like you're hungry. I get angry when I'm hungry. Let's go get a snack. Food is a wonderful redirection technique. We all love food. And don't tell me you don't, because you all do. So knowing what their favorite food is, keeping those chocolate graham crackers or, not straight up sugar, but something sweet because they all love the sugar, right? That you can redirect them to, that you can use as sort of a reward for them coming away from whatever it is that's agitating them or making them irritable. Familiarity. If there's another piece that I can, and this is the hardest part, I think, for a lot of my families, is that what we're asking you to do is develop routines and stick with those routines. The more familiar things are to people with dementia, the less likely they are to get agitated and irritable. It's very hard to live our lives doing the same thing every day, over and over and over again, right? But it's what the person with dementia needs to feel in control of their environment. So if every day after dinner, you get up and you clean up, and then it's time for your shower and we're going to get ready for bed, that becomes the routine. It becomes the expectation. It becomes the new normal. When you throw monkey wrenches into that, and families tell me all the time, oh yeah, the kids are coming down. We're going to take them out to the store, and we're going to go to the aquarium, and then we're going to go out to dinner, and my heart sinks. Just the kids coming down alone is changing the routine. And now they have no reserve. There's no cognitive reserve left. And we're going to ask them to shift how they understand what's going on in their life. So the way we manage that is by trying to maintain as much routine as possible. It would be great if we could all go out to dinner. It's not necessarily going to be in their best interest, but everybody can come to the house and we can do it at home and try to maintain as much routine as we possibly can. Is everybody warm? It's a little warm in here. I know. As abilities decline, use labels, pictures, schedules. Pictures are great. Visual cueing is something that we can do all the way until the very end of dementia. So if you want them to, take their pills, have a picture of a pill box with pills by the pill container. And when you bring it over to them, you point to them and you let them look at it and let them process that's what you're going to do. Think about how many times we go to a restaurant and they have pictures of the food on the menu. Why do you think they do that? Because then we're going to process that. We're already thinking about eating that food. We're looking at the pictures on the menu. They're very simple cueing, but they can make the difference between that anxious feeling of I don't know what she wants me to do versus, oh yeah, I've seen this picture. I know what I'm supposed to do in this situation. We already kind of talked about routines. Let's talk about simplifying the environment. Clutter. When you have a processing disorder, when you have anxiety, when you have dementia, clutter is one of your biggest nemesis. Okay? The more streamlined things can be, the easier they are, the more we simplify, right? I mean, maybe they had an oral hygiene routine of brushing their teeth and rinsing with mouthwash and flossing and using their water pick. Now